About a third of kids overall are bullied for any reason. The top reason why kids are bullied is because of weight. Weight bullying can be in person, it can be online, it can be verbal, so teasing or making fun of someone. It's often relational, so excluding someone from an activity or a friendship. It can also be the physical bullying that we think of when we think of bullying, so blocking someone so they can't leave a room and they feel scared, or beating them up. We see PTSD, post-traumatic stress disorder, developing in a subpopulation of kids because the bullying is so extreme and the reactions to it are so fearful. Again, if it's physical or relational, it doesn't matter. There can also be depression and anxiety. There can be self-harm and suicidality. And then we do see eating disorders specifically tied to weight bullying as well. Teenagers can be hard to start a conversation with, especially if they're in that mood where they don't want to talk to you. So the advice for parents is actually to make having open conversations as normal and as much a part of how the family works as possible, rather than waiting until there's something wrong and then trying to start open conversations at that point. We actually recommend as a field just not talking about weight. So not making it a taboo topic, but not directly saying, I think you should lose weight, or I think you should diet in order to get your weight down, but flipping it and focusing on the health. So saying, I want you to eat in a healthy way. I want you to make sure you're getting the nutrition that you need, and not tying it to that weight loss outcome. And in part it's because of the sensitivity of weight, but in part it's because that's not something people really have control over. There are so many factors that go into weight gain and weight loss beyond just eating and physical activity. So Teen Power started with a binge eating disorder treatment program. We developed a parallel treatment program for bullying in order to try to catch the kids who are experiencing bullying and treat those negative effects before they develop an eating disorder. It is definitely easier to treat the bullying, even if it's been happening for a little while, before it becomes a history of bullying and the trauma from that, as well as an eating disorder, or as well as one of those other consequences of bullying.